Hello all, welcome to Pharmanandar. Today in this video we are going to discuss eicosanoids. This is part 1 video and part 2 will be discussed in another video, right? The eicosanoids are one of the lipid derived attacoids. So what are attacoids? To brush a messenger which is secreted from the cell acting upon the same tissue at the same site, right? Among these attacoids, if they are derived from lipids, we call them as lipid derived attacoids. Examples are platelet activating factor, and the other group is eicosanoids. What are these eicosanoids? Eicosanoids are the things which are derived from eicosa 20 carbon compounds. So what are the examples of eicosanoids? Prostaglandins, okay, prostacyclins, thromboxanes, leukotrienes, and lipoxins. Okay, and when these prostaglandins, prostacyclins, thromboxanes, these three people consider them grouped together called as prostanoids. So what happens in the cell membrane? We know this is a cell. Cell is made up of lipid bilayer, right? Cell is made up of lipid bilayer. It is fat. Okay, it has phospholipids, right? These phospholipids are acted upon. We call them as cell membrane phospholipids, right? When these are acted upon by the enzyme phospholipase A2, the compound which is formed is called arachidonic acid, right? Which inhibits this phospholipase. Phospholipase is inhibited by phospholipase A2 enzyme, directly inhibited by steroids, right? So coming to the arachidonic acid sequelae, what happens to the fate of arachidonic acid? This arachidonic acid has multiple systems of metabolism, right? It can go with cytochrome enzyme, okay? It can get it can go through lipoxygenase pathway, it can go through cyclooxygenase pathway, right? Let us discuss cyclooxygenase pathway in this video, okay? This arachidonic acid, it can be acted upon by COX-1 enzyme group or COX-2 enzyme group also. These result in prostanoids. Prostanoids are the compounds which contain double bonds. Okay, that's why we always suppose PGE2, PGI2, all these together. Number 2 is present in prostanoids. Okay, what is the difference between this COX-1 and COX-2 mainly, which we should know? COX-1, it is usually associated with physiological thing. That's what we call them as housekeeping processes, right? It is associated with this thing. COX-2 is associated with mainly with, it is usually associated mainly with whenever there is inflammation. And where do we see this COX-2 activity more? And in cancer also. And this COX-1, COX-2, don't think it is confined to, it is physiological, it is pathological. Both can work together, both can work, are active in physiological, both are active in pathological process also. This is one more point we should never forget, right? These COX-1 and COX-2, both of them, these COX-1 and COX-2, both of them are involved both in physiological and pathological processes. Okay, so what are these prostanoids? Examples of these prostanoids. So what comes under prostanoids? Okay, PGD2. Okay, PGE2, PGI2, PGF2 alpha, and thromboxane A2. Okay, what are the receptors on which these prostanoids are going to act? Receptors. This PGD2, this prostanoid is going to act on the receptor. We call it as, this is D, right? D, prostanoid receptor. Okay, there are many DPR like 1, 2, 3, 4 something. Okay, DPR1 is clinically relevant. Okay, coming to the receptor of PGE2, what are the receptors of PGE2? You can easily say E, PGE2, right? E prostanoid receptor 1, E prostanoid receptor 2, E prostanoid receptor 3, E prostanoid receptor 4. Understood? What are the receptors of PGI2? We know I, PGI, IP receptor. Receptors of PGF2 alpha, F prostanoid receptor. Okay. Receptor for thromboxane, A2, T, P, R. R is here. Okay. So these are the receptors of the prostanoids. So pharmacologically speaking, what happens when these prostanoids are released and which type of prostanoids are acting on which organs? Let's discuss now. So let us take GIT. In the GIT, main prostanoids which we should learn is PGE2 and PGI2. Okay. For example, this is gut. Okay. Consider this is gut starting from mouth to anus, right? In this gut, what are the actions of these prostaglandins? First, this PGE2. Okay, this PGE2 has a property of PGE2 and PGI2, both of them has a property of increasing mucus secretion in GIT. This mucus secretion is increased when these two prostanoids are present here. Okay, these are secreted from the cells of the gut itself. Okay, what happens when mucus secretion is increased? Yes, we know it acts as cytoprotective, right? The second thing which these two can do is PGU2 and PGI2. These decrease the secretion of hydrochloric acid. Okay, this is good for GIT, right? So mucus is secreted more, HCl is secreted, right? So it safeguards the GIT, right? But when this mucus is secreted more, the side effect will we see as, because there is more secretion of these electrolytes and water into the gut, we see as a side effect of watery diarrhea. That is the reason these prostaglandins are not recommended very easily. They will think a while, doctors, before prescribing these prostaglandins, because watery diarrhea and too much of colic pain is seen when these prostaglandins or prostacyclin or this PGE2 or PGI2 analogs are given, right? And PGU2 only is involved in one more property here, not PGI2, only PGE2. We know the receptors of PGE2, right? E prostaglandin 1, 2, 3, 4 types are there, right? When it is mediated by this EPR4 type subtype of receptor mediated by this thing, what happens is this has a activity of stimulation of angiogenesis in the gut. Why this angiogenesis stimulation helps the patient? It helps the patient to promote whenever there is more angiogenesis at the wound area. What happens? We know in surgery when there is a wound to diabetic foot, we look for a more angiogenesis, right? Because it promotes healing of wounds. That is here gastrointestinal ulcers, right? What is the next organ on which prostanoids are acting? Coming to uterus. Okay. What are the things which are going to happen in the uterus? Okay. Prostanoids. Okay. We will write the name of the prostanoid, site of the prostanoid, what is the chief action going to occur there. Okay. First prostanoid we see PGE2. This PGE2, where it is secreted in the uterus, it is secreted when in a pregnant female by the amnion, right? What is the action of this PGE2? It has collagenolytic property, that is it can break the collagen which makes the tissue softening. Okay, this is used for cervical, it causes cervical ripening, it causes cervical ripening. What is the another prostanoid here? PGI2. What happens when PGI2 is in the uterus? How it is secreted from? It is synthesized or secreted or released from the myometrium of the uterus. Its action is it promotes uterine contractions. PGI2 promotes uterine contractions, that is through uterine myometrial contractions. And the third thing which we should learn here is PGF2 alpha, where it is produced from the decidua. What is the action? Same thing. It also promotes, just like PGI2, uterine myometrial contractions are promoted by PGF2 alpha. Okay. And in the exams, the questions which we see is what is the gold standard choice for cervical ripening? Gold standard choice for cervical ripening. Answer is local application of PGE2 gel. Okay. What is the potency if we compare between PGE2 and PGF2 alpha with regard to contractions? PGE2 is more potent. How much it is potent? It is almost 5 times potent in leading to the contractions of the uterus. Okay. What is the next organ involved? The next organ is blood vessels. Okay. What happens in the blood vessels when these prostanoids are acting? First thing which we should study is PGD2 or PGE2 and PGI2. All these three having similar actions. They cause vasodilation of the blood vessels. Okay, and they causes decrease in the platelet aggregation. platelet aggregation is decreased by these three independently. Okay, and what are the remaining prostanoids? PGF2 alpha, thromboxane A2. This causes vasoconstriction and increase in platelet aggregation. Okay, so F, it folds the blood vessels so that we can remember as it causes vasoconstriction. Okay, E for expansion of blood vessel. I also expands the blood vessel, so as we can remember easily this thing. And one more point is this PGE2 in the blood vessels, it maintains this patency of ductus arteriosus in fetus in embryonic stage in the womb during pregnancy up to delivery. So till the delivery PGE2 is secreted, it maintains the patency of the ductus arteriosus. After delivery PGE2 concentration secretion decreases, the duct will be closed, right? It causes two clinical scenarios which we will discuss later. Okay, and this PGI2, regarding PGI2, it has a property of atheroprotection. It is having atheroprotective property. See, when this vasodilation happens, there will be decrease in the blood pressure, right? When the blood vessel dilates, blood blood pressure will be decreased, right? So when we compare the potency of hypotension causing property, who is having more vasodilatory power, that is causing more hypotension, PGI2, okay, when compared to PGE2. Agreed? Next organ, clinically relevant thing is eye. In the eye, PGF2 alpha has property of increasing the drainage of the aqueous humor outflow. When aqueous humor is outflow increases, what happens? There will be less fluid, so IOP will be decreased. When we will think of decreasing IOP, yes, primary open angle glaucoma. Okay, in the next video we will discuss the clinically important drugs which are used based upon the currently discussed all the prostanoids. Okay, in the next video we will discuss the drugs acting with respect to in relation to these prostanoids. Okay, for any queries please feel free to send me email to farmanandan@zohomail.in, and you can put your comments, put your queries or doubts in comment section also in the below, right? Well, thank you for watching. Let us meet you in next video.